Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you. Oh, well, welcome back, and we're down here for the last 15 minutes of the show. It goes by really, really fast. But before I tell you what I was going to tell you before the break, we have Barbara on the phone. Barbara.
Hi.
Are you there?
Yeah, I'm here.
Great. What can I do for you?
Well, I have this book. It's called Miracle Medicine Foods, and it has a lot of things like garlic, about how it heals ulcers, and garlic about how it has all these things that it heals everything from arthritis, and garlic is like it heals phlegm, high blood pressure, also dissolves cholesterol, also prevents arteries from clogging and liver disorders and bladder infections. And what do you think about that?
Well, I think you're probably exactly right on with a lot of the natural benefits of garlic. The problem with it is that, you know, nobody's really ever done a study to promote that, but I've heard this over and over and over again on the good effects of that, and garlic and alcohol, you know, a little bit of wine, and olive oil and all the natural things. I mean, these are natural foods. And so...
Sick for like 4 or 5 years already, and I've been eating raw garlic in with my food. And I never catch colds. And if I have any phlegm, I eat garlic, which I never have any, and it's gone.
And you don't have to worry about vampires either.
Right. Yeah. Garlic. And if you have bad breath or anything, what's good to do is have a mint.
A mint?
Yes, a mint. If you put a mint in your mouth after you get done eating garlic, you cannot smell it anymore. I have a dog, and I went to kiss my dog after I ate some garlic, and I put a mint in my mouth. He came right up to me and started kissing me in the face.
He probably was hoping that there was you know, something good when garlic chicken, garlic. I mean, it's great. It smells good. I mean, it's great to eat and cook. So.
But dogs are not allowed to have garlic.
Dogs cannot have garlic.
Garlic is not allowed to have garlic because it's not good for their pancreas.
Did not know that. That's very good. Very good. Thank you for sharing that with us. I know there's a lot of things dogs can't eat. Saying we feed them.
Dogs cannot eat chocolate or raisins or grapes.
Yeah. Now I think there's milk chocolate they have, but dark chocolate maybe. I don't know. But it's probably better you not feed your dog anything but certified dog food, right? I mean that would be the right thing to do if you love them. Table scraps makes them fat, and you never know you're getting all the other stuff in there too. So, well, I applaud what you're doing with that. What's the name of that book?
It's called Miracle Medicine Foods by Rex Adams.
Okay, everybody out there.
70s.
Okay, so and I would concur that that garlic is great. A lot of things good for it, and continue to do that. Thank you, Barbara, for calling in and letting us know that and sharing that.
You're welcome.
Appreciate it. Have a great night. So anyway, when I left off at the break, we were talking about the fen-phen issue. So what happened was all of a sudden there was this, people were coming in, they were getting fen-phen, they were dropping a ton of weight. I mean, literally shut off their appetite. and their blood pressure was, moderate. There wasn't a problem. So out of the Mayo Clinic comes this mysterious study that shows it affects hearts, okay? And they did this ultrasound where they're taking the most morbidly obese people, and they're using these ultrasound studies, and they're coming up with this Doppler stuff. Who knows that they didn't have this injury as a result of being obese and having all the problems?
Who financed the study?
Well, you'll never know. But when that study hit, fen-phen was done, okay? And the point being is that I believe if you look at the new drugs coming out in the market today, the only ones that are out there are the ones that they know where R&D is going, that you're going to take for the rest of your life. You're going to actually take them for years and years and years to come. Yeah, that's why antibiotics cost $2,000 for 2 weeks, okay? Because
You're
they
not
have
going
to
to take me the rest of your life.
Well, you're not going to take them the rest of your life. So this is the big game that big pharmacy is playing. So fen-phen, I mean, look at all the diabetic drugs that have hit the market. The Victozas, the SGL2s, all these new diabetic drugs that are hit the market. You know how long they've been in the works? Years they've been in the works. So all these drug companies, R&D, they just put out one study and fen-phen goes away. What if everybody was losing weight and we're all thin, right?
They wouldn't have diabetes.
Exactly. Ray.
Yeah, Ray the Flagman again. I got this last call, and you just got a few minutes. First of all, Sylvia did not call locally. She called from Northern California. I mean, I told her about your show, and she says, I have to talk to the doctor, so I gave the phone number. So there you go. You're getting it long distance. You're getting interstate now. So I want to let you know.
That's awesome. Thank
That's
you.
great, Ray.
I sat through court this morning. I saw something outrageous. I'm going to make this brief, but it's about medical use of marijuana.
Okay.
There's a woman who's on probation. She has a medical use card. She was on oxys. They were destroying her. She has a bad back, and she has serious glaucoma where she's losing her eyesight. They're actually trying to get her off of that medical marijuana because they don't believe in it, and they want to violate her probation, which is ridiculous. It's still in turmoil. They don't know if they're going to do it or not. But the doctor has given her, the card, the medical use card, and they want to pull the card and just tell her, no, you're on probation, get back to oxys. And this is outrageous. You probably know anecdotally in your office how much medical use marijuana helps people. You can talk about that a little bit. I'd appreciate it. You guys had a good show tonight. I'll be watching next week. Keep the faith, power to the people, and thank God we saved the Tigers.
Thank you.
Thanks, Ray.
That's a shame, Ray. I really think that they either. I don't know what the rules for probation are, but if the drug is legal in the state, as authorized by the state legislature, and she has a medical condition from a doctor, who are the court system to challenge that? They don't practice, they're practicing medicine without a license. They're restricting this person's individual freedoms because the state has legitimized that. I know the feds look at it, but this is not a federal court, this is a state court. And if she's actually reduced her oxy dose and she's taken less pain pills, and she actually can show that, then she can show the physical proof that it helped her. And that would be, if I'm not a lawyer, but if that's what I'm going to do, I'm going to say, look, here is what she can get her pharmacy, she can go and grab from the pharmacy all of her prescriptions that she's filled. She can show that she's filled less prescriptions and taken less medications while she has been on that medication. And it's a legitimate reason to continue to use marijuana. I'm aghast that they would do that. We talked a little bit at the break. We have a couple of minutes left. But your best exercise?
Walking. Walking is probably the best thing that you can do. We talked about pushing yourself away from the table a little earlier at dinner time. This time of year, the sun doesn't go down until 8 o'clock. It's beautiful out. Tonight is a beautiful night. Eat less and walk more tonight. It's the best thing you can do for yourself. Get your heart rate up, get the digestive juices going. Have that food digested before you crawl into bed tonight, so it's not sitting in your stomach.
Making fat, right? Well, they said the thing about, I was laughing, but it's kind of sad. Beef, it's what's rotting in your colon. I don't think beef is a bad thing. I mean, I think if you eat grass-fed beef, I think it's fine. I think corn-fed beef. I've said this before. Watch the movie Food Incorporated. Mm-hmm. You would be amazed. With that thought, we're going to be signing off. Craig, thank you for being here.
Thank you, Doc.
All right, we'll see you next week.